So we did the cranial nerve exam. Now we're going to do a full neurological assessment. Along the way, I'll say words that we use to document normal findings and abnormal findings. So the first thing, we're seeing the patient in the clinic, we're seeing the patient in the hospital room. We're going to say, hi, my name is Tara. What's your name?
Caroline.
And where are you right now?
My dining room.
And what year is it?
2020.
Okay, so our patient is fully oriented. We can see that she's awake and alert and she has spontaneous eye opening. So that is our assessment of consciousness. And we already assessed level of cognition. So now we're going to go ahead and jump right into the cranial nerve exam. So remember, we don't test cranial nerve 1. Cranial nerve 2 is going to be assessed by the Snellen chart. So the Snellen chart is going to be 20 feet away. We'll have the patient cover the left eye, read the chart, the clearest line, cover the right eye, read the clearest line, and then that's their visual acuity. Then we're going to go to cranial nerve 3. This is my pen light. Go ahead and look at my nose. I'm going to shine the light into the left eye, looking at the left pupillary response, shine it in the left eye, looking at the right pupillary response, and then we're going to go ahead and do the same thing on the right eye, looking at the right pupil, right eye, looking at the left pupil. So we're looking for reactivity, brisk, we're looking at their circular, equal rounded reactive, okay? Then we're looking at cranial nerve 3. The other function is lid lag. Her eyes are open. She has no drooping of the lid. Then we're going to test cranial nerves 3, 4, and 6. Look at my finger. Go ahead and follow my finger. These are the 6 cardinal fields of gaze, up, down. And remember, we're looking for symmetry. We're looking for a conjugate gaze. Remember, if one eye strays, then it's a disconjugate gaze, and it's going to be indicative of a cranial nerve palsy. Next, we're going to do cranial nerve 7. Go ahead and smile. Puff out your cheeks. Close your eyes really, really tight. Don't let me pull them out. Then we're going to go ahead and do cranial nerve 5. This is going to be sharp. And this is going to be dull. Close your eyes. Is it sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
And sharp or dull?
Dull.
And remember that you want to test all 3 branches of the trigeminal nerve, and that's the trigeminal nerve is going to be intact to sensation. And you can also subjectively ask if she's having trouble chewing, and that's also something that the cranial nerve 5 innervates. Then we're going to go to cranial nerve 8. If she's able to hear me and follow commands, then we assume that that's intact. If you want to do something a little bit more in depth, you can put your hand over the patient's ear and ask them to repeat the word that you whisper in their ear.
Dog. Dog.
Then we're going to go cranial nerve 9. So go looking at uvula being midline, and this is also how the gag reflex is tested, but we're not going to do this on an intact patient. Then cranial nerve 10 is the vagus nerve. We just tested that when we went and then spinal accessory, shrug your shoulders, don't let me push down, and then we're going to go ahead and test cranial nerve 12. So stick out your tongue, move it from side to side, inside of your cheek, other side. And we see that there's no deviation, that the tongue is midline. Now we're going to go ahead and go right into the motor exam. So put your arms up like a chicken. Don't let me push down. This is shoulders or delts. Like make a bicep. These are going to be her bicep muscles. These push me away, her tricep muscles. Thumbs up. These are her extensors. Don't let me push down. Don't let me push down. Then we'll go to her lower extremities. This is her hip. Push up. Don't let me push down. Lift up. Don't let me push down. Now knee flexion and extension, you pull in, don't let me pull out. This is knee flexion, knee flexion. Now kick me away, knee extension, knee extension.